Hey everybody, welcome back to another episode of Hey Nurse Angel. On this episode, I'm just going to talk to you guys about the changes that COVID has done to the maternal and the pediatric ward, and then on the healthcare side of it, and then just kind of venture into a little bit of mental health that comes along with it. So, as we all know, we're in the middle of a pandemic. We're in the middle of a pandemic. Can y'all believe this? We're in the middle of a pandemic. Anyways, yes, we're in the middle of a pandemic. I still can't get over that. But anyways, COVID has brought about many emotions that sometimes can be indescribable. You know, you just feel like, is this really life? And I know I felt that quite a few times. When you're adding pregnancy on top of it, or being a new mom on top of that, it can feel unbearable. And I just want to let you guys know you're not alone in that aspect. And one of the things that I have noticed is people are feeling the lack of support when it comes to being pregnant, newly just having a baby, or, you know, your baby is a toddler or school age or high school, and you have just came to a point where it's already just you and your child. You don't have a support system at home like you do when you are able to take your child to school, when you're able to go visit family. And so the lack of support that has been brought about with COVID is not nothing that you're going through alone. When I was working in the NICU earlier this spring, I noticed a lot of moms first of all, it came to a point that they couldn't come in the hospital at all. Then it came back to, okay, they could come back. It could be one parent. And then it came back, okay, now it can be two parents. And so a lot of the moms are brand new moms, their first time having a baby. And unfortunately, their babies are in the hospital because whether they were born prematurely, born sick, or whatever the case may be, their babies were in the NICU with us. And it broke my heart to see how no one had control over the situation. Like, this wasn't done, you know, no one's purposely doing this to anyone. No one's telling you, you know, you can't come to your baby, or you can't, you know, it's a very unfair situation to be brought into. And not that anyone expected this to happen, but it is what it is. And I just kind of want to put you guys on game to like what's going on in the healthcare world. So, when it comes to COVID, if you're in the maternal ward and you're going and you're about to give birth, just know most hospitals right now do have the one support system rule. So one person for support to come in, whether it's the father of the baby, your mother, your sister, your best friend. You have one person to choose, and that person can come and stay there throughout the entire process. I know some hospitals are as strict as like that person cannot leave the hospital until you leave the hospital. If they leave, they can't come back. So, you know, check with your hospital, call ahead of time and make sure you know what's going on. But it's still pretty strict right now because COVID is still running rampant. Just because everybody's outside having fun does not necessarily mean that we're done with our pandemic. We're still in the middle of it. So that's kind of where we're at with that. When it comes to children, I know that the hospital that I was working at, we were allowing at one point both parents. The latest I had before I had left, it was both parents were allowed to be in the baby's room, but that was it. Like, that was it. There's no alternative to you can have a baby, you know. It's just there was no other alternative. Only time I think you could have more than those two people in the room was if unforeseen circumstances happen and the baby is about to pass away and we're doing bereavement, then they allowed more family members to come in. But that's on a case-by-case basis. So, biggest issue with this whole visitor rule situation right now is the lack of support that is there for not only the mother, but if your baby's in the hospital, for the baby. The baby, yes, you know, they're not cognitive saying, I miss my mom, but babies can feel the presence. They know when it's skin to skin. Like, all that's very important. So, what does this mean for you, right? As a mom, of a newborn baby, as a mom of a toddler, as a mom still expecting. What does this mean for you? This means that it's very important for you to guard your mental health. When it comes to anxiety, depression, those mental health issues are absolutely valid. It is okay to feel those feelings. I don't want you to think that your anxiety or that level of like, I just don't know, so now I'm not sure, and all that's normal at this point, and all of it's okay to feel. I don't want you to feel guilty for, not being happy every single moment. A lot has been stripped from you since you've been pregnant, and it's COVID, and you can't have your baby shower, and you can't visit family, and you can't, prepare for this birth the way that you wanted to, because you can't have everyone there that you will want to be there. And it may feel like so much is out of your control, and it is right now. So it's okay to have these fears and these feelings that you're just like, I just don't know. Here's some cool tips I have for you guys in regards to having to go into the hospital, whether it's for you about to give birth or whether it's to visit your baby. So tip number 1, communication. I want you guys to make sure you guys have an iPad, a phone, a computer with a camera, whatever you can to help be able to communicate between you and your family members who can't be at the hospital. Another very important thing, don't forget the charger. Super important. Number 2, reading materials. I personally love the convenience of audiobooks and Kindle on your phone. Then it's a 2-in-1 deal. If you're grabbing your phone to communicate, you have your books there as well. But I also am a lover of physical books. And so if you're just like me and you love physical books, make sure you tuck away a book or two that you've been trying to read into your already made bag for your, about to go to the hospital. Tuck a few books in there. Also, fun things are like crossword puzzles, coloring books. I love to color, so that's something I probably want to throw in mine just to kind of keep my mind at ease. And, when I feel the stress and anxiety of things, it's just something to do. Number 3, don't forget to ask questions. And when I say ask questions, you don't have to wait until you get to the hospital to ask these questions. You can call your doctor's office and inquire about whatever questions you may have. You can also call the hospital prior to. If you have any questions regarding visitor policy or just anything of that nature, they should be able to help you out. One thing about asking questions, I know people refuse to ask questions because they think that you're annoying the nurse or the doctor, whoever you're asking the question to. But asking questions is the only way you're going to get your answers. So don't feel guilty for having these questions or wanting to ask these questions. Ask them and know that it's in good conscience that we understand what you're going through and the level of anxiety that you may be having due to COVID. So ask away. And if you're just completely like, I don't know, anything, feel free to ask me and I will gladly be able to help you out. Number 4, bring multiple masks. Don't just have a mask that you're wearing in be the only mask you have there, because if it drops on the floor, if it actually gets thrown away, or whatever the case may be, it could be a million and one things. You want to make sure that you have multiple masks for you and your support partner. Number 5, give yourself some grace. We are going through something that we have never been through before, and we all just need to be able to be more kind and be more gracious to ourselves, to others, yes, but also to ourselves. Because you have literally just grown a human for 10 months or less if if your baby's in the NICU and it came, a few weeks early. You grew a baby. Give yourself some grace and understand that it's going to take a minute for your emotions to really tie to not only having this baby, but having this baby during a pandemic. Like, can I just congratulate y'all? Like, for real, when it comes down to it, you guys are superwomen. Any mother is a superwoman, but mothers during pandemics, y'all are just a new breed, okay? Because it's taking a lot out of us nurses, and I can't imagine the extra, added everything that it's taking for you guys to have to go through this as well. So I commend you guys for not only having a successful pregnancy, but having a healthy baby. And if your baby does end up in the NICU, because let's be honest, if we're being very clear about things. Not every pregnancy is always healthy, and baby goes home with you after day 3. There are some situations that are unfortunate and baby does end up in NICU. And I don't ever want the moms to ever feel guilty, like it's their fault that their baby ended up there. It is not. It is not your fault. But us NICU nurses are here to help and get you through it. And just know that you need to give yourself the grace to know that, yes, you did a great job as long as you could. And now it's on us to handle it. So, big picture, give yourself some grace. All right, whether it's a hug, give yourself a hug, whether it's a pat on the back, whether it's you telling yourself every morning, thank you. Like you're telling your body, thank you for doing what you needed to do. Telling your mind, thank you for waking up and, being in the right space. Telling your people around you that you love, I love you. Telling yourself, I love you. I think one of the biggest things is we don't really give ourselves enough grace in this day and age. And I think we're so big on, showing kindness to others. And yes, that is important, but don't forget to do it to yourself as well. And so with that, I am bringing to you guys my very special friend in an upcoming episode. She is a psychologist. She's beautiful, and she's going to help you guys with just a few tips to get through this season. So stay tuned. If you're a new mom, if you're an expecting mom, hit me up in the comments below and let me know how you guys are handling this time and what I can do to be of assistance.